October is Breast Cancer Awareness Month. According to the American Cancer Society, breast cancer is the most common cancer in women in the United States outside of skin cancer. It accounts for 30% of all new female cancers each year. According to the CDC, nearly 13,000 new cases of breast cancer were reported across West Virginia and Ohio in 2023. Each Wednesday in October, we will take an in-depth look at the fight against breast cancer. Our Shyla Florence joins us live in the studio for this week's episode. Shyla.
That the average woman has a 13% risk of developing breast cancer in their life. That is 1 in 8 women. Last week, we told you about the different types of breast cancer. Today, we're looking into the different ways doctors will test and diagnose breast cancer. The National Cancer Institute says that more than 1 million women undergo a breast biopsy each year, but only about 20% of those result in a breast cancer diagnosis. There are many ways healthcare providers can test for breast cancer. The first recommended testing is through self-breast exams and clinical breast exams. While clinical breast exams typically begin during annual wellness checkups when women are around 20 years old, it's never too early for self-breast exams. Nurse practitioner Joe Hendershot with WVU Medicine Camden-Clark says this is because the better a woman knows her body, the easier she can spot anything abnormal.
Normal for one is not normal for another. So your provider may not necessarily know that this is an abnormal for your breast tissue. You know because you're checking your breasts regularly.
Besides conducting breast exams, Tracy Smith, the Director of Imaging Services at WVU Medicine Camden-Clark, says screening mammograms are typically where each woman normally starts once they turn 40.
You know, every woman will start with a screening mammography exam. From there, that really dictates where your care goes from that point. If your screening mammogram is normal, we're going to see you back in 1 year, and we want to see you have that once a year, every year. If there's something that we find on your screening mammo, then we're going to go through different steps based on that.
After receiving an abnormal screening mammogram, the next steps might be a biopsy or a diagnostic mammogram. A diagnostic mammogram is similar to a screening mammogram, but it's more in-depth. There are also 2 different types of mammograms, a 2D mammogram and a 3D mammogram.
The difference between a 2D mammogram and a 3D mammogram is the 2-dimensional mammograms were really 2 pictures of each breast. The 3D mammogram is thin slices through the breast. So you're looking at images of the breast in 300 to 500 slices as opposed to 2 images. So just the fine detail that we're going through the breast to see if there's any abnormalities, the 3D technology really brings that to us.
Starting last month in September of 2024, the FDA started requiring healthcare providers to report the level of density in a woman's breast to enhance their ability to provide the best testing options.
Why that's important is because a mammogram may not be the best screening for that patient. What it looks like when somebody has dense breast tissue is sort of like white spots on a mammogram. Cancer looks like white spots on a mammogram. So being able to determine the difference in dense breast tissue and tumors or cancerous cells is very difficult to see through that density.
This allows younger patients or anyone with denser tissue the ability to undergo different testing options. This could be an MRI or a breast ultrasound, or simply an additional screening mammogram in 6 months versus a year.
The structure of your breast changes as you age. When you're younger, the tissue is more dense. As you get older, the tissue becomes fatty replaced and your breasts are softer. In the years where your breasts are very dense, mammography has a difficult time penetrating through that denser breast. So we do see that a lot of our younger patients that either feel something in their breast, have a significant family history, they're going to send them in for the ultrasound for us to look with ultrasound in that dense breast. And sometimes that happens too when you have your mammogram and we put on your mammogram and we see that the tissue is still very dense in your breast. We may ask for the ultrasound to be done in correlation with that to make sure we're not missing anything. So, you know, anything we do to make the resolution top-notch on these machines to see through that dense breast tissue is really a benefit to the patient.
While there are many ways to test for breast abnormalities, the American Cancer Society says a biopsy is the only way to truly diagnose breast cancer. There are 4 different types of biopsies that can be performed depending on the size and location of the tumor or lump in question. For WTAP News, I'm Shyla Florence. This is Home. The list for the different types of biopsies can be found on our digital story at WTAP.com. There you can also find steps on how to perform a self-breast exam and what to look out for. Once someone is diagnosed with breast cancer, the doctor will most likely order lab tests to assist with prognosis. Those results will help determine the best treatment options, which we will get into next week. Phyllis, back to you.